Hello, my name is Kathryn Taylor, and I'll be presenting our work on the impact of treat to target guidelines on disease monitoring activities among privately insured patients with inflammatory bowel disease. The STRIDE 1 guidelines were published in 2015 to establish therapeutic targets for the treatment of inflammatory bowel disease with the aim of standardizing clinical practice. STRIDE 2 in 2021 then grouped these targets into SHORT, which were clinical response, intermediate, which was the normalization of laboratory markers, and long-term endpoints, which is the improvement in endoscopy or imaging, and provided timelines for each advanced therapy. However, it is unknown if the release of these guidelines actually influenced monitoring practice. We identified all non-elderly adults with Crohn's disease or ulcerative colitis who were started on a new advanced therapy, which includes biologics and small molecules from the MarketScan commercial database. We then calculated the time between starting this new advanced therapy and various disease monitoring activities that are recommended in STRIDE, including outpatient GI visit, C-reactive protein and fecal calprotectin, and either endoscopy or enterography, depending on the underlying disorder, whether Crohn's or ulcerative colitis. We then use multivariable linear regression to compare a time to event before and after the publication of the STRIDE 1 guidelines published in 2015, after adjusting for demographics and healthcare utilization. Our results, we first report the demographics of patients with inflammatory bowel disease starting in advanced therapy in the first table on the left-hand side. We had 32,872 patients with Crohn's disease and about 14,000 with ulcerative colitis. The Crohn's disease cohort tended to have more female patients, be younger, have more all-cause hospitalization and emergency room visits and surgery in the year prior, whereas ulcerative colitis tended to have more remote and recent prednisone use. And then the first panel of figures on the left, we show the median days from starting advanced therapy to surveillance outcomes from 2008 to 2021. And as you can see for both Crohn's and ulcerative colitis, all of our surveillance outcomes slightly increased over that time period from 2008 to 2020. The bar in the middle represents 2015 when the STRIDE 1 guidelines were published. On the right-hand side of our results, we first report the change in days from starting in advanced therapy to surveillance outcomes after the STRIDE 1 guidelines were published in 2015. We have the unadjusted and adjusted change for both Crohn's and ulcerative colitis for each of the outcomes. And all of these were statistically significant with a p-value of less than 0.001. In our last table, we show the weeks to surveillance outcomes versus the STRIDE 2 recommendations, which were published in 2021. And for each of our outcomes, we show in the first column the weeks that we found from our data and our analysis with a 95% confidence interval compared to the STRIDE 2 guideline recommendation in weeks to checking each of those monitoring outcomes. And as you can see, for every medication for both Crohn's and ulcerative colitis, we found that the timeline was longer than the recommended time in the STRIDE 2 guidelines. In conclusion, we found that the median time to disease monitoring activities increased between the 2008 to 2021 period, despite the publication of the STRIDE guidelines. That the median time to disease monitoring was greater than all recommended STRIDE 2 timelines. The smallest changes in disease monitoring timelines occurred in time to laboratory markers, including CRP or fecal calprotectin, and the largest changes occurred in time to endoscopy for ulcerative colitis patients. We feel that more intensive monitoring is needed to achieve these treat to target guidelines so that patients with inflammatory bowel disease can either continue on their current advanced therapy or be switched to one that might be more effective for them. Our future directions, we hope to continue to evaluate the impact of STRIDE 2, which was published in 2021 as more recent years of data become available in the MarketScan commercial database. We also hope to focus future studies on the impact of insurance type 1 variation and time to monitoring. And we also hope to better understand factors why STRIDE guidelines are not followed in clinical practice, including better understanding why this may be at the provider, the practice, the systems, or the insurer level. Thank you.